Hi, my name is Savannah, and today I am going to be teaching Amy, my patient, how to test her blood sugar. So the first thing you'll want to do is clear off a nice big open space and gather your supplies. The patient may bring in their home monitor in a bag like this, or they may be getting a new monitor in a box. But what you'll want to do is take everything out. So you'll first take out their meter and put it on the table, the lancing device, the test strips, a few Lancets for them to practice with and you to show them. And then if you also want the alcohol wipe and a cotton ball. And then you're going to want to take away anything else off the table so it's a nice clear empty space for them to work with and it's not too overwhelming with a lot of materials and junk that you don't need. So now that we have everything on the table, the first thing we're going to want to do is explain what each part is to the patient. So we'll start off with the most important, the meter. So this is your blood glucose meter. It tells you exactly what your sugar is at the time that you're testing. And then once you're done explaining that, we're going to put it away, off out of sight. Next is the strips. So you can go ahead and open it up, show it to them, and take it out. Take one out, for example, and show that there's two ends on the strip. So there's one end that goes into the meter. It looks like a computer chip, and you'll know that computer goes to computer. And then the other end is a little bit of like a vacuum, and it sucks the blood up off their finger. And then that's all we're gonna say for now. Put it away and out of sight. Next is the lancing device. So some patients may not recognize what that name is if they're not familiar or newly diagnosed. So one thing we can say is that is the poker, and that's what gets the blood out. And we'll explain how to use this in a minute, so just explaining what this is. And we're gonna leave this out because that's gonna be the first thing we tell them. And then these are the lancing devices, or the needles. And that's all we're gonna explain for now. And now that we've explained what each part is and put aside the materials we're not using, we're going to show them exactly how to load their Lancet and use it to draw up blood. The first things first is you're going to want to explain that each lancing device will have numbers according to the sensitivity of the needle stick. So one is going to be the lowest depth. It's going to not go as deep into their skin, whereas somebody who works with their hands a lot, maybe has a lot of calluses, may need a stronger strength like 5. So we'll dial it up based on what they need. Typically, we start most patients off with a 3 and adjust from there if they don't need as intense of a poke to get up enough blood, or if they need something a little bit stronger or they're struggling to get blood up. Okay, this is your lancing device. This is what's actually going to be used to get the blood out of your finger. There's numbers up here that you can twist and adjust. One is going to be the shallowest, so that means the needle isn't going to go into your skin as deep as it would with 5. So 5 is more of an intense prick. If you have calluses or rough fingers and you find that you're not able to get enough blood up with 1, you can go up to a higher number, and that'll be a little bit more of an intense finger stick. And the next part that we're going to go through is the actual Lancet and how to insert it into the lancing device. And so these are your Lancets. This is the actual needle that is inserted into the lancing device. You're going to want to make sure you change this every time you perform a blood sugar test, just to keep yourself safe and sanitary. To insert it, all you're going to do is twist off this white portion. You can see there's 2 little knobs right here. This is the locked position. You'll twist it to unlock and lift. Next, you're just going to insert the Lancet into the device, like so. Press down until you hear a click. That means it's inserted. And then this top part twists off like a bottle cap. And you want to make sure you're doing it slowly and carefully so you don't accidentally stick yourself, but you can see it's a very small needle, so nothing to be afraid of. And then you're just going to carefully put this cap back on. You can see it's unlocked, twist it to lock, and then to load the needle, all you have to do is pull back the plunger. And then you should be ready, and just verify that your sensitivity is where you need it. and then we're going to pick a place to perform our test. But first, I want you to show me how you would be able to do this. Do you feel comfortable doing that?
Mm-hmm.
Okay. All right, so here's your materials if you would like to show me how you would do it.
Okay, so on the white base, go ahead and twist it, take off the cap. Then I will put in the lancet in here, and until I hear a click. Then twist off the cap like a bottle cap, and then place the cap back on, like that. And I'll put it on number 3, because I've never pricked myself before, and I don't know how deep I want it to go yet.
That's perfect, and you already got it loaded, so it's good to go. All right, thank you. All right, and now that you've taught them how to load the lancet, you're gonna also wanna teach them how to unload the lancet. So the safest way that we've found is to twist off the cap, take it off, and then stab the little top of the bottle cap. And so you'll just go through that with the patient and have them perform it as well. So now that we've taught you how to load, another important part is being able to unload and take the needle out safely. So what you're gonna do is you're gonna unlock the top part again, and you're gonna take it off carefully, and what you're gonna do is just put the needle into the cap, and then you'll press this gray plunger once it's all done. And I'll just have you show me how you would do that.
Okay, so go ahead and twist to open it. Go ahead and put the needle into the top of the bottle cap, and then use this gray plunger to take out the lancet, either on the table or to put in the sharps, or I could do that directly into the sharps.
That's perfect.
Awesome.
All right, now that we've assessed that the patient is comfortable performing or getting the lancing device ready, we're gonna move it out of sight, out of mind to the end of the table, and then bring back in the meter and the test strips and kind of explain how that process works. So now this is your meter like we talked about. There is a lot of fancy features that it does, but for your first time, I just want you to feel comfortable getting it ready, seeing your sugar, and writing it down in a separate log. So we will discuss that at a later time, but to use the meter, all you have to do is stick that computer chip end into the meter like we talked about earlier, and that will turn the meter on. And you can see that it pops up and it tells you to insert blood. So then now that you feel comfortable with your lancing device, you'll then perform a finger stick and use your this end to suck up the blood into the meter so the meter can read it for you. Do you feel comfortable turning on your meter?
Yes.
Okay, great. So now that we've talked through kind of the two separate parts, getting ready and actually performing the test, we can tell the patient that that's pretty much the process and see if they feel comfortable going through the entire process on themselves and performing a finger stick right now. There are a few education pieces you'll want to remind them before you perform finger sticks about location, getting a good blood supply, so warming up your hands, and we'll talk through that before you let them take charge and go through and perform their own stick. All right, and that is your process of checking your blood sugars. So when we put it all together, do you think you'd feel comfortable doing that on your own?
Mm-hmm.
Okay, so a few things I want to remind you before I let you go loose. Testing locations. A lot of people test on the pads of their fingers, and we don't want to do that because that's the most sensitive part. So what we're going to do before we test is make sure our hands are warm. That'll help get blood there. So if you want to rub them together a few times, sit on them, whatever you may do. And then actual testing sites, you're going to want to put your hands together, and you can see along the edge of your fingertips are really good testing spots. Those are a little bit less sensitive. And another thing that you want to remember is to change sites as frequently as possible. So getting ready, we're going to want to wash our hands, or if you're in a place where you can't wash your hands, you're going to want to use an alcohol swab. Clean off the area that you choose. and then get your Lancet ready and the monitor out and the test strip ready to go.
Sounds
All right.
good.
Any questions?
For the alcohol swab, do I have to wait for it to dry, or can I go ahead and just swab it and then prick my finger?
Yeah, that's a great question. So you are going to want to let the alcohol evaporate into the air. That is when you know it's done its job and all the germs and stuff are gone. So you're going to want to swipe, let it dry, let it evaporate, and that'll also help with any pain. Sometimes if it is still a little bit wet, you can get pain with the injection. That's a great question.
Yes.
Thank you for asking.
All right.
Anything else?
Nope, I think I'm ready.
All right, great. Now that we've gone over all the key counseling tips and explained what every part of the blood sugar testing is, we're going to have the patient go through a full test on their own and make sure they don't forget any steps or help them out with any tips. Maybe you forgot to mention something and you notice it when they're doing theirs. So that's a good way to double check you and double check them. Now, if you don't mind, I'd like you to go through the whole process yourself and actually take your blood sugar right now. And we can see how you do, and then I'll make sure there's nothing that I missed, and you'll be ready to go home and test on your own.
Perfect. Okay, so first I guess I will load the Lancet, the lancing device with the Lancet. So I'll go ahead and put this in, and I heard a click, and then twist off the cap and put on this cap. I'm gonna put it on number 3 and then pull this back to load it and put that over to the side. Then I will put my strip into the meter and it turns on and it's ready for the sample. Then I'm gonna go ahead and wipe the side of my middle finger. It's the site I've chosen. I'll wait for it to evaporate. And okay. Then go ahead on the side and press the gray button and try to get some blood. And then is there a certain spot that I have to put the test strip? Can I just like stick it?
So it's
like
best
this?
to put the arch of the blood right on the end of the test strip like this.
Okay.
That's perfect, and then it'll just suck it up. You don't need to put it on top. I would say the best technique could be picking it up with your other hand and then going in at the angle.
Okay.
But that was perfect. You did it great.
All right, and then it shows my reading on the screen. Perfect.
Great. Well, and one last thing before the patient leaves. This is a really overwhelming process for a lot of people, so you want to make sure that you congratulate them and let them know that it is an extensive process and that if they ever do have any questions, they're more than welcome to call us, come back in, any concerns with anything, that we're here for them and that they did a really good job and that it's a big learning process. All right, congratulations. This is a huge learning process, but you did a really good job, and I'm confident that you're going to be able to test your blood sugars at home really well. It is a big process, and you did great, but if you ever do have any questions or you don't feel comfortable with what you're doing, you're more than welcome to reach out to us. We're here anytime you need us.
Thanks.
All right.